So another method is absorption through the skin. We know that we can absorb a lot of things through our skin, and it's a really great way to get cannabis into the body. That may come in the form of oils or lotions or creams or salves. Also liniments. So oils, lotions, creams, and salves are usually have a fat-based or an oil base to them, where liniments are an alcohol base, but it's not an alcohol that you would drink. It's an alcohol that you would rub on your skin. It's you don't see liniments as much on the market as you used to, but herbalists are making them all the time. It's a very effective way to get product into the body, into the bloodstream, because alcohol absorbs really well through the skin. There are dermal patches. They're not on the market yet. So we've seen dermal patches, which is basically just a medicated patch that you would put on your skin, and you would leave it on for a day or sometimes a week. And it would, the ones that you leave on longer are kind of time released over time. That product that's on there gets absorbed through the skin into the bloodstream. Those are pretty popular for hormone replacement therapy, or for people who, like a nicotine patch for people who are trying to stop smoking. And these dermal patches for cannabis use are coming, but they're just not approved for sale in Canada at this point. But they should be showing up in the market over the next months and maybe years. So that might be a really convenient way for people to take their low dose cannabis medicine over a period of time, and very discreet as well, because nobody can see, as long as you have clothing is covering it, nobody can see that you have that patch on. For the effects to be felt with absorption method, it can take up to 30 minutes before you get some relief from that. The effects can last anywhere from 1 to 4 hours. So depending on what you're treating and the product and how severe the symptoms are and how well you react to the product that you're taking, you may have to be reapplying it quite often, or maybe just 2 or 3 times a day. Products that carry THC in them, so products that you put onto your skin that have THC on them, you're going to read a lot of books that say, and online websites and blogs that say, oh, when you put THC products on your skin, you're not going to get high from it. That is absolutely not true. You can very easily become impaired by absorbing THC through the skin. So don't believe any of that. Don't use a THC-based topical product before you have to drive, or if you're having to do anything responsible, until you understand how that product works within your body and whether you're going to get impaired from it. So when would you use this absorption method using topical products? It's really great for spot treatment of arthritic joints or pains, those kinds of things. You wouldn't ever want to use that on an open wound or a cut, although there are some specific products on the market for that, like first aid bombs and stuff like that. But it would have to be specifically made for use on open wounds. But you can certainly, if you had an open wound, you could use it around there, just not on the open wound itself. Skin conditions like eczema and psoriasis, it can be quite helpful. A lot of people, like some of the licensed producers, are selling a cream that has either already been medicated or an unmedicated cream, and then they just tell you to take your oil product and mix the oil product into the cream itself. That can work, but it actually dilutes the oil product out. So if you don't need a super strong one to use topically, that's a good way to stretch out your oil, and then you would just rub it on the affected joint or where the pain is on a regular basis in order to manage that condition. But I've also found, you can just take your oil products that you can buy from your licensed producer and with your dropper, and just take 2 or 3, maybe 4 drops of that oil directly in the area that needs to be treated, and just rub it in really well. You don't need a full dropper full. You don't need to sort of slather it all on. Just a few drops, rub it in really well. Avoid wearing any clothing for 10 or 15 minutes to allow that to really absorb properly into the skin. And that can work quite well as well. In fact, sometimes that works quite a bit better. Other places that people are using their oils topically as an absorption method, in addition to using them orally or instead of using them orally, women with menstrual cramping. So if you have that sort of cramping both in the front of the body and in the lower back, you can rub a few drops on there. That seems to be quite helpful for people. And then some people who just, maybe it's not specifically arthritis, but they get kind of super stiff, or after doing a really hard workout, sometimes rubbing some of that oil or a liniment on the skin that has a little bit of cannabis in it can be quite helpful, speed up recovery time, and just get you moving a little bit better. So lots of applications for absorption. There's not a lot in the regulated market right now. They're actually fairly easy to make at home. You do need a little bit of knowledge, a little bit of special equipment with that. But again, you can just take your edible oil and use that topically as well. A little bit pricey to do that, but it's effective, and you don't need a lot at a time. So another absorption method is called mucosal absorption, and those are sprays or drops that are specifically designed to go into the nose or into the nasal cavity. There's also a dissolving wafer that's not on the market yet, but it is coming. So that would be where those little wafers, you can buy that technology right now in like breath fresheners, where it's just like a little paper thin wafer that you would put on your tongue, let that dissolve down. It absorbs, the medication in there absorbs through your mucosa in your mouth. And that can be quite an effective way of getting some product into you. This can take 20 to 60 minutes before you start to feel any effects in the body. And again, that only lasts 1 to 4 hours, again, depending on how much you've taken, what you're treating, and what, how well you are absorbing this. So it's relatively quick way for people who don't want to inhale their products. So it's an alternative to an inhalation method. Not as efficient as inhaling it, but it's an alternative, because there are some people out there who just don't want to inhale products, but they need something that is fast acting. Okay, and we'll look at suppositories now, and these are products that are designed to be inserted either in through the anus, the rectum, or into the vagina. They can take effect in 20 to 60 minutes. Again, lasts 4 to 12 hours. Again, that's kind of a big range there, but it has so many things that it depends on. Again, you're going to read in a lot of books and blogs and websites that you can't get high when you take a suppository of cannabis. Again, absolutely not true. You have just as much potential for impairment by using a THC suppository as eating the THC itself. So again, be very careful with that, especially for new users who are using it. So suppositories are a really great way of getting cannabis products into the body, especially for below the belt issues for both men and women. So reproductive issues for women, such as menstrual cramping we've talked about, and cancers, below the belt cancers for both men and women. Again, we don't want to make any promises, but this is another method that we can use. It can be messy, so if somebody's using that, of course you want to be, at night is probably the most convenient way, and then put a towel down on the sheets. And it's also a really great alternative for patients that have compromised digestion or they can't tolerate eating cannabis. And sometimes that happens with people who have fairly complex disease happening within their body, and they might not be able to eat properly. So again, there's an ick factor with suppositories. It used to be a much more common medicine in the world, and then once we got more pill forms and stuff like that, people just don't like that ick factor of the suppositories, but it's a very effective medicine. It's a really effective way of getting a product into the body. It can absorb into the bloodstream, and then especially if we're working with below the belt health issues, it might be a good way to kind of get that medication directly to where it's needed. So let's do a summary of the intake methods that we just talked about. There's a little table there that you can take a look at. If you can use that as a reference point. So we have the onset time goes from inhalation, which is the quickest, 2 to 5 minutes, and then ingestion, which does take the longest, can take up to 120 minutes. And then the absorption, mucosal, and suppositories are varying degrees of how long before it takes effect. And then duration, both ingestion and suppositories are the longest lasting of product in the body, sometimes up to 12 hours, 6 to 12 hours. And then inhalation and absorption mucosal, 1 to 4 hours there usually. And the advantages, inhalation, it's really quick relief. Ingestion, it's very long lasting. Absorption is great for spot treating places around the body. And both mucosal and suppositories are really good ways of bypassing the digestive process if that's an issue, if someone has compromised digestion or can't tolerate eating the product itself. So you may have heard the term microdosing, and microdosing is simply taking small amounts, maybe more frequently or just small amounts less often. But it's really helpful for people who can't tolerate large doses at once, or for people who need to kind of have a sustained intake of the product over the course of several hours or throughout the day. Microdosing, we're starting to hear about microdosing in other areas of medicine as well, and it can be quite an effective method for people in various situations. One of the things that we found with microdosing is when you take below their therapeutic dose, so if you're taking a dosage amount just below therapeutic dose, sometimes people find that they become more sensitized to the product and they need less and less over time. Where conversely, if somebody's constantly taking above the therapeutic dose, they can actually build up a tolerance to that product and require higher and higher dosages of the product. So what's a therapeutic dose? Great question. Everybody's therapeutic dose is going to be different. So we would describe a therapeutic dose as the dosage that you're taking that's going to keep your medical condition or your symptoms well managed for a period of time. So again, I know that's really vague, but it's very individual for each person and each situation, and it can change over time as well as your body shifts and changes based on the medication that you're taking or the progress of the disease or the health conditions that you're treating. So there really is no specific therapeutic dose for anything. A therapeutic dose can be thought of as a very individualized or personal dosage. There are some cases where we want someone to be able to take larger amounts of THC, and so we would specifically build up their tolerance to being able to manage higher doses of THC. And a great way to do that is through microdosing. So we just take, if we're talking about a THC oil, for the first a little while, we just take a few drops, and then you would slowly, drop by drop, increase that dosage over time. So you're taking tiny amounts, maybe a little bit more often, rather than large amounts once or twice a day. There's an interesting phenomena that we find in medicine that applies really well to how cannabis works within the body, and this is called the biphasic response. So it just basically means that there's a differing effect in the body based on the dosage. So often once you find your therapeutic dose, you're going to get very beneficial results from that. If you take too much of a dosage, you may get the complete opposite thing happening. So an example is low dose THC can help manage anxiety, but high dose THC for some people can actually create anxiety. So again, there's that, it's an interesting phenomenon that can happen. So if we look at this little diagram here, we have our low benefit and our high benefit on the y-axis here, and then we have our low dose and our high dose on the axis down here, and then right in the middle we have our optimal dose. So a low dose may have low benefit, a high dose may have low benefit, but the optimal dose might have high benefit. So again, what's that optimal dose? What's your therapeutic dose? Really individualized, and that's something that as an educator you would help someone figure that out for themselves. A great way to help someone find out what their therapeutic dose is by having them keep a journal, and that can be quite detailed journal that they can use. They can write down, sort of rate their symptoms on 1 to 10 before they start the dose, and then an hour, 2 hours, 3 hours after they take whatever dose that they take. And then see, over time you can start to see patterns of what dosage is working best for you and when that will kick in for you as well. So it does get to be a little bit complex, but there is a way of figuring this out. Now also know that that what your optimal dose is, or your therapeutic dose is today, in 3 months from now, it could be a very different dosage. It could be much lower or it could be much higher, because our bodies are very dynamic. We're always changing and shifting and growing and healing and having other stressors that are maybe degrading our health over time. So we're quite dynamic. So it would make sense to treat our medication that we're using as if we're treating something dynamic. You'll find that you'll be able to stabilize on a dose for a period of time, and some people can stay there, year after year, and other people are constantly adjusting their dosage every 2 to 3 months just to keep up with the changes that their body is going through. So tolerance is a term that you may have heard, and we talk about tolerance a lot in the cannabis industry, or for cannabis users, cannabis medical users. There's other places medically where the word tolerance comes up. And tolerance is just described as a state of adaptation in which exposure to the drug causes changes that result in a diminution of one or more of the drug's effects over time. So basically it's saying that over time, if you build what's referred to as building tolerance, or you become, your tolerance is quite high to something, that just means that over time, the effects that you used to get from a lower dose, you need much higher doses in order to get the same effects. And that's just your body adapting to it. There is a technical term for this. It's called membrane receptor endosome internalization. All that's basically saying is those receptors that are in the cell wall that where the cannabinoids will attach to, they basically say, hey, I'm done. I've had enough of this. And they will actually pull themselves into the cell or shut themselves down. We have a sort of a kind of a diagram representing that here. And we're talking specifically about THC tolerance here. So if we think of this green area along here as being the cell wall, and each of these little triangle shapes as being a receptor, and you can see on the desensitization side, those receptors are all up there on top of the cell wall, and they're ready to accept the THC. And when we get that tolerance starting to build up, those receptors actually either shut down or pull themselves into the cell so they can no longer be stimulated. And so there's fewer cells or fewer receptors on that cell wall to be stimulated, which means you need more product in order to get the same result. So tolerance can happen even just within a few hours, or it can take a few weeks, a few months for that tolerance to build up. So sometimes you'll hear recreational cannabis users kind of joke that they smoke themselves straight. So that just simply means they've been hanging out with their buddies, smoking cannabis all day long. They sort of got themselves to a state of intoxication or euphoria or psychoactivity, however you want to call it. They are able to sustain sustain that through continuous, usually smoking over a period of time, and then all of a sudden it doesn't matter how much more they smoke, those receptors have basically pulled themselves into the cell and said, I'm done. I'm not accepting any more of that THC. And basically they could smoke another whole bag full of cannabis and they wouldn't get high again from it. So that is where tolerance has built up really quickly. But more often we'll see tolerance build up over people who are using it on a regular daily basis, and that could build up over a few days, a few weeks, and sometimes it can be 6 months before somebody notices a tolerance. How do you know or notice that you are starting to build up a tolerance? Well, it's just that you require more and more product in order to achieve the same results or symptom management that you used to get from a very small dosage. Tolerance levels are going to change based on a person's genetics, how much they're using, how often they're using it. All kinds of things affect how a person builds up a tolerance. And we can counteract that tolerance in a couple of ways. One is a sensitization protocol, and that helps to just basically resensitize those receptors. So remember we talked about how those receptors, when they're done, they basically pull themselves into the cell so they can't be stimulated anymore. So a sensitization protocol would just kind of coax those receptors kind of back out to the surface of the cell and be open again to receiving that THC or cannabinoids from there. Sensitization protocol can take anywhere from 24 hours or even 3 months or longer. And the only way to do that is to abstain from using cannabis products for that amount of time. Now, someone who is using cannabis products to manage, really complex health conditions, they might not be able to go without their cannabis product for 3 months in order to reset all those receptor sites. That could also cause them a lot of stress to think that, oh my God, I can't use my medicine for 3 months. How am I going to be able to cope? So if you are working with someone who is a person who requires regular cannabis, especially in high dose THC, and they're taking it long term, 2 or 3 times a day or more, then what we want to do with those people is we want to have them constantly change product. And that can be disruptive for a person's routine as well, because if they find a product that's working really well, the next one they try might not work as well. So again, it takes a bit of juggling with this one, but if you are working with someone who requires higher concentrated THC several times a day long term, then we want to just be advising them to be always using different products and sort of try and trick those receptors from not shutting down on us. Okay, so that is our module on methods of medicating and tolerance, and I hope that gives you a few ideas. In a later module, we'll be looking more at product choice and how we can sort of use what we learned in this module on how to apply that when you're choosing your product. And then also just we made you aware of tolerance, that can happen, and a couple of ways that we can manage tolerance if it does happen in someone who does require larger amounts of cannabis.